My name is Lesley. I'm a physiotherapy grad from Western, and I'm currently an advanced healthcare practice graduate student in sport and exercise medicine, and I work at the Fowler Kennedy Clinic here in London at Western. I've always been an athlete myself. My passion for sport medicine started when I tore my ACL, and then I kind of realized that I wasn't going to be able to stay in sports as an athlete at the level I wanted to for the rest of my life. So physiotherapy and sport medicine was really that avenue to stay involved in some level of high-level competitive sport and be a part of the team in that way. After I graduated from Western, I think what's important is I went to Fowler to do a fellowship in sport medicine. After doing 2 years of exclusively sport coverage and high hours of varsity sport and only seeing athletes, I think the Advanced Health Care program in sport and exercise medicine was a great opportunity to solidify what I've learned through those fellowship programs. And then it also takes an interesting turn in advanced healthcare practice, so where physios can progress medicine in the future, as well as academia, so research and possibly teaching. The clinical mentorship program has been really awesome, having one individual to run things by and review cases and meet on a regular basis with has been really helpful, and it cancels out the rest of the noise of all this other learning that goes on. So I found that has been really, really helpful, and I'm very thankful for my mentor for putting up with me for the whole year. So I've really enjoyed that portion. What's unique about it and what I've really enjoyed is the collaboration between medicine and physiotherapy. So having the docs and the physios together in one learning environment is, I think, really unique and is really pushing the needle forward in terms of advanced healthcare practice. Even just seeing how the two groups collaborate from an outside perspective, or from watching them collaborate, who they typically don't get to collaborate with each other, is really unique, because the physios don't get the chance to talk with doctors about anything that they do on a regular basis, and the docs usually don't know what the physios do, but we're always referring to each other. So I think it's really unique, and it creates a really great approach for us as future clinicians or advanced healthcare practitioners in order to provide better care for our patients. There's different sessions throughout the entire 2 weeks that we're there. So we would have a collaborative day where we're talking with the doctors and going through clinical scenarios with them, and the physios can put their input in. And then we'll have another session later on in the day where we have a panel discussion where they've brought in, today, for example, a psychologist and a nutritionist and a sport med doc and a physio, and they all talk about a case from their different perspectives, and we're allowed to ask questions. So it's a very open environment. It's not a lot of lecturing at you. And then usually if they've had some clinical experiences where we get to go shadow some of the people at Fowler Kennedy, so going and doing rounds with our orthopedic surgeons or our sport med docs and getting some shadowing experience as well. What we're learning supports what you're doing in clinic. So one day we'll learn about something, and then you'll see it in clinic the next day, and the puzzle pieces will kind of fit together. I think that really has set me apart from other people who haven't had that experience. It has really built on my clinical reasoning skills, my injury management skills, and then my interpersonal skills, both with the patient and with all the different colleagues that I get to work with on a daily basis. You could have the same case in 5 different scenarios, and we've had this in our class, and each person with a little bit of a nuance change and more of their biopsychosocial versus the injury in itself is going to change how we approach the case, which is really cool. Now, as a practicing physiotherapist, I'm hopeful that my patients' subjective outcomes, so how their injury process went, how they're able to understand their injury and be able to cope with that and be independent with those injuries, has improved with my ability to educate them on what's going on and provide clinical reasoning again, and an adequate reasoning for what I'm doing and why I'm doing. I think that's really what has hopefully benefited my patients. A lot of this, and even in my physio school and the SEM program, is a lot of networking. I think that's really what helps a lot as well. You get to meet a lot of different people with a very diverse set of backgrounds and knowledge, and it's really taking advantage of your time with them and trying to get as much information, and don't be afraid to ask questions and really dive into what they're talking about, because you get to know them better, you get better knowledge from them, and then you have a network moving forward. There's been a number of people who are well into their career that have come back and taken this, and people who are already in professional sport who are coming back to take this. But it's easy to become stagnant. It's easy to get into habits. So if anything, this is going to push you to think outside of the box and to, again, network and talk to other people and have new ideas. And I think that's valuable in itself. I see that there's a future where advanced healthcare practice really gets pushed to those boundaries in Canada, where physiotherapists are taking on roles that can actually make systemic changes. We can alleviate healthcare costs, wait times, patient outcomes, and provide more opportunities for our colleagues in medicine to follow more acute care. I'm really excited about the role that physio will have in the future in the primary care and emergency field, and really taking on an advanced healthcare practitioner role with an advanced scope of practice. I think as healthcare practitioners, we're always encouraging other people to take care of themselves and focus on themselves, and we're in that caring role. But the best investment you can give to yourself is investing in yourself, and this is a way that you can invest in your future and invest in yourself. And even though you've done your physiotherapy degree, learning never stops, and there's always a lot more that you can learn when you actually pursue those things.